We all make decisions every day. Take buying groceries, for example. Make the wrong choice at the supermarket and you could end up with a lousy dinner. No big deal. But choose the wrong health care plan and you could be tied up in financial knots that could take years to untangle. For Glenn and Kimmy Vox, health insurance took on a whole new meaning once they started a family.
The biggest thing is trying to figure out in terms of meeting co-pays with office visits, is that going to be enough to meet our deductible each year?
In the Vox household, the family budget isn't the only thing under consideration.
We looked at our health issues as well. Both of our children have asthma, so we probably visit the doctor more than a normal person would.
With me having high blood pressure, that means that we also have to get prescriptions quite often.
So those are things that we have to look at as well as how many times do we think we're going to visit the doctor each year.
Glenn and Kimmy look at their coverage options as they would any major purchase. The key for anyone in the market for health care insurance is to become a smart shopper.
If you're an employee who is looking at health plans that your employer offers, it's important to understand what health plans are offered, what type of plan is being offered, and that you consider your family budget and what type of health care consumer you are before you decide to enroll in a particular plan.
And this will give you a fuller definition of how our two plans work.
Open enrollment is a very popular process that provides employees an open forum to ask questions for the employer to respond.
Okay, so you've got all the information from your employer, but come on, there's a ton of material here, and some of the terminology inside is hard to understand. But don't let that discourage you. You really need to read through these because it's a decision that could affect your life for a long, long time. And if you get to a part of the plan that you don't understand, ask questions.
I camped out in the benefits office of my company, which is where our plan is, and literally I was down to the last hour that we had to sign up for our insurance plan for the coming year, asking questions, asking about different options. Can you tell me what doctors are on this plan, or how do we find out?
A big piece of the puzzle for Glenn and Kimmy was finding out what doctors are part of their PPO, or Preferred Provider Organization. No two PPOs are the same. Some employers offer more than one PPO. The type with more providers typically costs more, while a smaller group of healthcare providers may be offered at a lower premium. In Kimmy and Glenn's case, the smaller group did not include two of their physicians.
It was pretty stressful. I mean, we talked about every part of it, including maybe in order to keep those doctors paying more than $1,000 more a year. We really had to take the time to talk to other doctors who could meet our needs so that we wouldn't have to pay more money.
Another factor that needs to be considered: does your plan provide additional coverage such as dental or vision care? If not, you could be hit with some major out-of-pocket expenses. But some employers offer savings plans to help you put aside your pre-tax dollars for health care purchases not covered in the plan. One option is a flexible spending account, which usually comes with a use it or lose it clause. That means any savings not spent by the end of the year cannot be carried over to the next. However, your employer may offer an even better choice.
Inquire with the employer as to whether or not they offer a health savings account. This is a plan that's newly available that allows employees to contribute money into an account that can be rolled forward year to year. It's also something that's portable. If they should leave employment, they can take that balance in their account and use it down the road.
The more you know about your insurance, the fewer surprises you'll have, and the easier it will be to live with your choices.
We have a lot of peace of mind. I work in the healthcare industry, and I'm exposed to a lot of people who don't have these choices. They don't have healthcare plans. So we really appreciate and feel blessed to have access to this.
A little time, a little research goes a long way when you're making a choice about healthcare coverage. Just ask Glenn and Kimmy. There's a lot riding on it. For Smart Medicine, I'm Rod Starnes.
Joining me now is insurance broker Jack DeWald. Jack, thanks so much for joining us.
Glad to be here. Thank you for having me.
Normally a person gets their health insurance through their job.
Correct.
So what happens if you decide to get your health insurance someplace else?
Understand that your employer is typically subsidizing the cost of it in a big, big way. Sometimes employers pay 50, 75, even 100% of what somebody's health insurance is. Even if it's just for the employee may have to pay to cover their spouse and children, but it's greatly subsidized.
So if I quit my job and I need insurance, what do I do then? Find
out if COBRA is available to you, which is an extension that you can purchase. And some people that have lost their jobs through layoffs or quits find that, and they suddenly realize how much their employer's been subsidizing it because they get that full ticket bill. If you need to go out in the commercial market to do that, you can go and buy individual insurance policies, either long-term individual policies, or there are such things as short-term or interim policies that people can buy when they've been laid off, or if they're between jobs, or maybe they're a student or a former student. A lot of people need to pay attention to kids that are maybe on the 5 or 6 year plan in college and the health insurance only covers them to age 20 or 21, or things like that. So there are short-term policies they can purchase.
So if I'm going to buy my own insurance, where do I go? What do I do?
My advice to you is to find an insurance advisor that you can trust. There are national trade associations, NAIFA and NAHU, that have find an agent locators on their websites where you can, if you have one that you're dealing with, that's the best place. If not, if you need to find one, find a trusted advisor that'll sit down and listen to you, understand what your questions and concerns are, and interview a couple of them. Ask for references, things like that.
Thanks so much for joining us.